Susan, welcome.
Good afternoon.
Afternoon to you.
Thank you for having me here. I have my colleague Lynn Raskin beside me. She's the Chief Executive Officer of the South Riverdale Community Health Centre, in case you have questions for me that I am unable to answer. My name is Susan Varden, and I'm a board member of South Riverdale Community Health Centre. I've lived in Riverdale for over 20 years, and it has been a wonderful place for me to live and raise my 3 children, who are now aged 17, 15, and 13 years old. I'm incredibly proud to be associated with South Riverdale Community Health Centre. South Riverdale does an exceptional job of providing a range of healthcare services and supports for people living in our community, and most particularly for those individuals who face poverty and are often forced to live on the margins of seemingly prosperous communities. One of the programs I'm most fond of and proud of at South Riverdale is their harm reduction program. It began in the late 1990s with a proactive needle exchange. This program, along with others like it in the City of Toronto, was a key factor in the relatively low incidence of HIV transmission from needle sharing in Toronto in the early 2000s. Toronto's rate in those days was around 7% compared to 24% in other major cities across Toronto. At present, it's closer to 4%. This is something we should all be very proud of. South Riverdale seeks to decrease the social barriers to positive health outcomes for people who use illegal drugs. I've been both touched and humbled to hear from and meet the volunteers and staff associated with the program, and the sense of care, dignity, and community that is so evident amongst those involved in the delivery of the harm reduction program. I'm here to support South Riverdale's application to become a supervised injection service for a number of reasons. Firstly, because it is a simple build on a center of excellence that is about respect, dignity, and results. I want to live in a community that is proud to stand up tall and say we will care for our fellow citizens. We are our brother's keepers, and this application to expand the range of harm reduction services for injection drug users by adding a supervised injection service to the Queen Street East location allows us to build on 20 years of experience in this field. It will also allow us to continue to save lives of those living and using illegal drugs in our community. And lastly, it will allow this organization to continue to contribute to building a safe and healthy community in South Riverdale. Thank you for taking the time, giving me the opportunity to speak with you today, and I do hope you will support the proposal in front of you for the community consultations. Do you have any questions?
Thank you very much. Are there any questions? Visiting councillors first. Councillor Fletcher.
Thank you. Nice to see you here today. I just have a few questions about the community consultations that you're planning to hold for the site. Can you just tell me a little bit about that, please? Or let the board know.
All I can say is that there's about 5, and they're on Thursday evenings, but Lynn will have more detail.
So the current plan is for us to run a series of open houses on 6 Thursdays from the beginning of April to the middle of March. Middle of May, and in addition to doing a broader community consultations, then evaluating who we haven't reached, and continue to do this up until the July meeting.
Thank you. Good afternoon, and thank you for the chance to speak to you today. I've been in front of this board twice before, in 1989 and 1990, in regard to HIV prevention. And it is HIV prevention that brings me back once again, this time to plead that the board enthusiastically endorse supervised injection sites or services, as the frontline experts call it. I've lived in Riverdale for the past 38 years. I'm a doctor and I'm a relative of an injection heroin user. On a Saturday afternoon years ago, I visited my heroin-dependent relative only to waken him and his late-teen friends after an all-night binge of injection heroin use. I saw plenty in the early years of the AIDS epidemic. On another Saturday afternoon, I also once woke a house full of injection heroin users, 3 being my patients, in the west end of Toronto, one of whom was skeletal from AIDS, the only supplies in the house being used needles and Ensure cans. It was not safe for my relative, and it was not safe for my patients. I had a heroin-dependent patient. His partner accidentally overdosed and died while injecting. He was charged with manslaughter, but was fortunately acquitted. I'm an Ontario colleague, a typical straight-laced person from an upper-middle-class neighborhood who traced her wayward injection drug-using adult child to Insight in Vancouver. Her child was safe, and the colleague became a convert to supervised injection services. One consequence of witnessing the devastation of HIV amongst people who inject drugs was a public decision in 1989 by the then Toronto HIV Primary Care Physician Group for its AIDS physician members to hand out clean needles in their medical offices, this occurring before Toronto Public Health initiated its needle exchange program. The downtown AIDS physicians knew that clean needles would save lives, no matter how controversial actions were at the time. And so it is with the supervised injection services, except it should be a lot easier this time around. The evidence is solid, whether in Canada or internationally. Supervised injection sites are safer for injection drug users and safer for the communities in which they're located. Finally, one can ignore the documented benefits to injection drug users of supervised injection sites, deride the human rights arguments which raise legitimate questions as to why a standard medical treatment should be subject to any review or vetting by citizens, and one can scorn the lifestyles of those who use drugs. But one need not be a scientist or humanist to know that supervised injection services located in an existing facility where people are already receiving clean needles can only prevent them from using in public places, conduct which puts not only the users but their neighbors at risk. Better to use under health professional supervision than on the streets. It is that simple. Thank you for so patiently listening to me.
Oh, that was efficient. Any questions?
You ordered me to do it.
And you follow orders well?
Not usually from the States.
Not the
to tell you
Dr.
truth.
Berger I know, okay.
Good afternoon, everyone. So I'm Julia, and I'm from Wood Green Community Services. Now, Wood Green Community Services is one of the largest social service agencies in Toronto, and for over 79 years now, Wood Green, a founding member of the United Way of Toronto, has grown to span 36 locations and serves about 37,000 people a year, and among whom are homeless and marginalized people. Now, South Riverdale Community Health Center is a valued collaborative partner with Wood Green in several programs. They have an excellent track record and expertise in the area of harm reduction and community health. Wood Green is able to support community members to benefit from these types of harm reduction initiatives through our drop-in at our 650 Queen Street location, which has safe and confidential space for drug users to obtain clean kits. Now, Wood Green obtains these safe injection kits and safe inhalation kits from South Riverdale Community Health Center. And in last year, Wood Green distributed about 1,102 kits. And this initiative does reduce the occurrence of needle sharing, pipe sharing, and consequently the spread of disease in the community. However, many community members, while able to access these kits through Wood Green, do use in public washrooms or outdoors. In Toronto, about 54% of individuals who inject drugs inject in a public place, such as a bathroom or a stairwell. So recently, one situation occurred in the public bathroom at our 650 site. And that highlights the need for properly supervised sites. So this public bathroom that we have at our 650 site can only be used by one person at a time, and although it has sharp containers and can be locked from inside. An individual recently was in the bathroom for some time and raised some concerns of our staff. Our staff tried to knock on the door, and there was no answer for a while. But finally, when the person responded and said, he told us he had been very close to an overdose. So the potential for an overdose incident is a daily and a grave concern for us at Wood Green. And although harm reduction is part of our core approach, and our space might be safer than on the streets or in other public indoor spaces, the risk of accidental death occurring is still very high at our site. Having a supervised injection site within walking distance and overseen by South Riverdale Community Health Center would benefit community members and create a safer environment at large. We believe that a supervised injection site would decrease the overall rate of overdose and public use. In addition, we feel that having a site would really encourage community members to get easier access to other types of services, including rehab. So Wood Green fully supports the proposal of South Riverdale Community Health Center managing a supervised injection site, and we encourage the Board of Health to continue to engage in dialogue and engage in broader consultations. Thank you.
Good afternoon, Board of Health members. Thank you for allowing me to speak on this issue. My name is Leslie Madaw. I'm here in my capacity as a board member of South Riverdale. You've heard from my colleague, Susan Varden. As Susan has already mentioned, there is obviously strong and unanimous support on the South Riverdale board for the proposal that's before the board today. But I'm here to speak to you today more in my capacity as a community member of Leslieville. I live only a few blocks away from South Riverdale. I'm a mother of 4, kids under 10. I've been very active in the community for the past 10 years. And I think at its heart, I'm here because I believe that a community is judged by how it treats its most vulnerable members. And I moved to Leslieville because it was an inclusive and diverse community. And I believe that the situation of a social program like a supervised injection site in our community will affirm the value of inclusiveness and compassion in the Leslieville community. So as I said, I'm an active and longtime member of the Leslieville community, a community which I care deeply about and to which I feel very connected. While I can't say I speak for all members of the Leslieville community, I do believe there is strong support for the idea that this program will save and improve lives and make the community safer. Since the announcement last Monday of the proposal, I have been reaching out to friends and neighbors, both in person and online, through social media. I have started a Leslieville Supports Supervised Injection Sites Facebook page, and we've also started a local petition of support, which to date has over 500 signatures. It is directed at those who live and work in Leslieville. And the response, as I said, we've had 500 signatures on that petition, as well as incredible support in local Facebook pages. There are those that have a different view, but I think that it's fair to say that the response from the community has really been remarkable and incredibly heartwarming. It's made me very proud to be a Leslievillian. Many people have demonstrated not simply tolerance, but genuine support for and real understanding of the pressing public health issue at stake and the need for this service in our community. One of the comments I'd just like to share from one of our community members, and this is, I think, representative of the kind of things I'm hearing from my fellow, my neighbors and friends. As a nurse and resident of the Leslieville area, I fully support this initiative. The evidence shows that SIS saves lives and supports inclusive, healthy, and safe communities. Again,
Sorry, Leslie.
yes, absolutely.
Just give you your final bit.
Absolutely. And just the only other issue that I'd like to raise is the issue of community safety, and that is a concern that some folks have raised, and I do strongly believe that this will, in fact, increase public safety by reducing public drug use and by decreasing the number of needles that we find in our community. Thank you very much.
Great, thank you very much.
My name is Margaret Harvey, and I live in Riverdale with my husband Peter and our 2 children. When we bought our house in 2004, we fell in love with the neighborhood, and not just for its leafy parks, amazing Danforth restaurants, and trendy Queen Street East. We also loved the sense of community that we felt as soon as we moved in. We love the values of caring, inclusiveness, and kindness demonstrated by our former MP Jack Layton, our current MP Julie DeBruson, our MPP Peter Tabbins, and our ward councillor Paula Fletcher. Values that seem to flow both ways to and from them and the people who live there and elected them. After we moved in, a close cousin, Stephen Barbier, also made his home nearby in Leslieville, where he now owns 2 houses and lives on Moore Street around the corner from the South Riverdale Community Health Center, raising his 2 daughters. We spend a lot of time together in Riverdale and Leslieville and have discussed the potential for a safe injection site in our community, and we are both very supportive of this initiative. I have seen firsthand how the community has changed over the years and the positive impact that the South Riverdale Community Health Center has had. I have done some research, and based on what I've read about similar projects in Vancouver, this can only be a good thing for our community. My children, aged 8 and 9, both attend Holy Name Catholic School, and one of the things I love about that school is that the wide catchment area provides them exposure to a varied demographic. It's a very inclusive community, and no one gets left behind. I feel that the inclusive values of our school are shared by the wider community of Riverdale and Leslieville. As a community, we owe it to ourselves and to each other to make harm reduction a priority, to give the vulnerable a chance to get the help they need, and to make our streets, parks, and other public spaces safer for everyone. That's it.
Hi, I'm a physician and researcher at the Center for Research on Inner City Health at St. Michael's Hospital and of Health Policy and Professor of Medicine and of Health Policy Management and Evaluation at the University of Toronto. I'm here today as one of the lead investigators of the TSCA study, which you've heard something about already today, along with Dr. Carol Strike from the University of Toronto. TSCA was a feasibility and needs assessment for supervised injection services. We used multiple different scientific research methods to generate our recommendations. You've heard a lot about the evidence already, so I'm going to try and focus on things that I think haven't been emphasized today. But I do want to start by emphasizing that the main reason to open supervised injection facilities is quite simply to improve the health and well-being of people who inject drugs. There are many other reasons, such as moving drugs use out of parks and alleys and their economic benefits, but the primary reason is to save lives and to improve quality of life. People who inject drugs are more likely than the general population to die at an early age, and if they don't die, they have a high burden of disease. Harm reduction interventions such as supervised injection services are an important and effective way to address the health issues for people who inject drugs and people who need something beyond conventional health care. We've already heard about overdoses. As has been widely reported, overdose rates have increased markedly in Toronto. What is less well appreciated, I think, is that overdose rates have increased even more rapidly in Western Canada and parts of the United States. We are now starting to see increased use of drugs like fentanyl and heroin in Ontario. Overdose rates may soon increase even more in Toronto if there is no public health response. The time to act to prevent further overdose-related deaths is now. We recommended 3 integrated facilities, as did Dr. McEwen in our report. I want to briefly review some of the reasons for that. Stigma, discrimination, and privacy. People who use drugs benefit from having services delivered in environments that are free of discrimination, where drug use is not stigmatized, and where their privacy will be respected. The 3 proposed facilities are located within organizations that have a long history of providing exceptionally high-quality services to people who use drugs. Access, an integrated model, increases the potential to access a wide range of health services and social services. Efficiency, integrating supervised injection services into existing facilities avoids duplicating already existing services. Scale up, because providers in existing facilities have established relationships with people who use drugs, these facilities have the potential for timely development of a client base for supervised injection. And community integration, integrating supervised injection services within facilities where people are already receiving harm reduction services will help to address concerns about how to incorporate supervised injection into neighborhoods. And finally, cost. Delivering supervised injection services in pre-existing facilities is less costly and potentially more cost-effective than establishing freestanding supervised injection facilities. This is an important consideration for implementation, but it's also important when considering how many facilities should be established. When we conducted the economic analysis, we looked at the potential cost of operating a facility, the potential cost savings from averting adverse health effects associated with injection drugs, and projected health benefits. The important point here is that we base our operating costs on the experience of freestanding facilities, such as those in Vancouver and Australia. And as we gain experience with the model being proposed in Toronto, it's important to monitor the associated costs, as it may very well be cost-effective to have even more facilities than the 3 proposed in the future. I want to talk very briefly about the importance of community consultation.
It'd be good if you went to in conclusion, therefore.
In conclusion, the next few months are going to offer an important opportunity to have a respectful dialogue that's both an education and a collaboration among the people of Toronto to address the health needs of people who use drugs, and hopefully to start a broader public dialogue about our society's approach to drug use and addiction.
Thank you. Thank you very much. Appreciate your comments. Are there any questions? Very quick question. Do you have any cost numbers around how much is saved through safe injection site? Because some folks really like those numbers.
Yeah, so we know
per capita basis.
When we did the analysis for Vancouver, we estimated that there was cost savings over 10 years of about $14 million. Because we don't know what the operating costs are going to be here, it's hard to project what the cost is going to be. But it certainly will be cost effective. We estimate to operate 3 facilities, and those were based on very conservative assumptions.